Everyone. I'd like to introduce Jessica Villeneuve. Jessica has been a registered massage therapist, or RMT, for over 10 years, having completed her post-degree program in massage therapy and successfully completing board certification exams with the College of Massage Therapists of Ontario before moving to Alberta to begin her practice. Jessica was a member of the Board of Directors of the Massage Therapist Association of Alberta for 3 years, holding the position Vice Chair and spearheading the MTAA School Approval Program to raise the standards of education for massage therapists in our province. She has also represented the MTAA as the Vice Chair of the Transitional Council for the future College of Massage Therapists of Alberta, and currently sits on the working group for the regulation of massage therapy in Alberta. Jessica is passionate about the regulation of the profession in this province to ensure safe and effective care for Albertans. Jessica has been both an instructor and program coordinator for massage therapy schools in Alberta and is the creator of her own continuing education courses for healthcare providers. She has presented to a variety of patient populations, healthcare providers, and government officials. Jessica founded her company, Same Stars Wellness, in 2013 to provide ethical treatment to both pediatric and adult patients with complex conditions such as neuropathy disorders, cerebral palsy, mixed abilities, palliative care, oncology, migraine disease, and chronic pain. Jessica is a patient advocate, a chronic pain sufferer herself, and believes that care comes not only in the form of treatment, but from listening, validating, and supporting.
The mental health aspects. Linda, thank you again for sending this. Linda sent me the symptoms separate to the physical neuropathy pain, and honestly, I can say myself, I've experienced all of the following, and I personally don't think that there is enough emphasis put on the mental health aspect of neuropathy or chronic pain in general. So it is something that I really am happy to touch on because there's ways we can help. So treating anxiety, depression, or mental health in general, though, is outside of your massage therapist scope of practice. So they cannot or should not be offering you any sort of psychological suggestions. If we're chatting pain patient to pain patient, I'm say like, yeah, like if I'm having a really bad pain day, I at least tell myself this is not your fault, instead of a therapist who has never had any pains. And I'm like, well, have you considered meditating? No. So those are things that social workers, psychologists, psychiatrists are going to be offering you. But the one thing I can tell you is if you find a healthcare provider who validates your experience, is compassionate to your pain and concerns, and is invested in your healthcare, it is so helpful to the mental health aspect of neuropathy and chronic pain. It makes a difference when you feel heard, when you feel seen, when you feel accepted, and when that practitioner tells you, I can't quite understand, but that must be incredibly challenging. Let's do our best to try and help you. It makes it seem like finally it doesn't seem like you're just complaining anymore. But yeah, this actually really does suck. So thank goodness somebody is going to help me. So the anxiety over the future, is it going to get worse? Are you going to be able to make your appointments tomorrow? What is next week going to look like? What am I going to miss? How am I going to have to reschedule my life? How horrible is it going to be? You start stressing yourself out with these thoughts, but they're completely valid thoughts, because who else lives with a body that they don't know how they're going to be tomorrow? Maybe they're not going to go grocery shopping. Average, normal people with no pain don't have that. So you can explain that as, I think that's one of the best ways to explain to a practitioner that doesn't seem to be understanding your pain or the implications it has, is literally saying, well, how do you think you'd feel if you wouldn't know if you could go to your kid's graduation tomorrow because you might be in pain? Same as if that person started stressing over getting in a car accident. Like, yeah, that's a bad day. Well, our normal bad days are sometimes more frequent than the good days. So with massage therapy, we can help those symptoms of anxiety as well. So it gives you that hour on the table or wherever you choose to have treatment. You can ask for relaxing music. We can try and work on the shoulders, the neck, the breathing muscles. We can show you breathing techniques to help you deal with some of that anxiety. If you have someone that validates your concerns, it helps with the anxiety. The fear of falling or being like this forever. We can't tell you you're not going to fall or that you won't be like this forever, but we can help you not fall. So as a physiotherapist, as a movement specialist, and maybe giving you some stability work, we can help make sure that the other muscles or the other limb is nice and strong and moving as great as possible. So if you're constantly putting more of the pressure on the right side, let your therapist know that. Let them know that you're having concerns about falling so that we can make sure we spend lots of time on that right side as well. So it's in the best shape possible.
Yeah, and a lot of people, they get frustrated or they feel shame because they can't do things. And, sometimes the families or friends or even healthcare providers are not validating it, and they're doing the exact opposite, which can be, I'm sure you've experienced it, can be very disheartening for people.
It's horrible, especially when it is, quote, a silent disease and you don't have something that they're looking at and saying like, oh, well, that must really hurt, right? Well, it does really hurt. You just can't see it. You can see my hurt, but you can't see what's causing my hurt. So it's hard. The anger is a big one too. You're allowed to be angry. I had a therapist once tell me, like, we went once. It was a psychologist, not a massage therapist. Just, maybe you should be thankful. Like, if you're having a bad day, you should just go outside and look at the sun and be thankful for it. I'm like, no. I have photophobia with migraines. I can't go look at the sun. But I was like, wow, you clearly have nothing wrong with you if that's what you're telling me. So don't support your practitioners if you can choose to leave them, say if it's not a specialist, if they are downplaying your concerns. Because no, you don't have to be grateful for the pain. We do try and work through a biopsychosocial model where we work on still staying somewhat as active as possible, still being as socially engaged as possible, which is great actually, because with COVID, like now we can talk to our friends and family on Zoom. We don't have to go to a 50-person outing.
Yep.
But if you need to not do those things, that's okay. And talking about providers, cancellation policies are there for a reason. I understand that. But when you have chronic pain and neuropathy and you are threatened with having to pay for a therapy that you couldn't attend due to your pain, I find that it's a conflict of interest almost. So if it's a pain day or if there's a mobility issue or it's too much, I know our practice, like I have a rule that they don't charge, because I've had that happen to me. I'm like, how did you want me to drive there? And that person that's supposed to be helping you is charging you, so it's shaming you. That's not helpful. It's not helpful to your condition because you're most likely not going to be able to get to the appointment, but it's also very detrimental to the mental health because you feel like you've failed or you're more angry. Isolation and loneliness, abandonment. The one thing that I think is a great option for people, especially if it is a mobility concern and you do feel isolated and it's not, you still would like to see practitioners, is find somebody that will come to you. Don't let that be a roadblock to you. It's sometimes hard. There's not mobile everything, but there's mobile hairdressers now. There's mobile acupuncturists. There's mobile massage therapists. So those are options. It's pretty awesome, and it means that you can still get great care. Loss of friends and family supports, that happens. People, I don't know if I'm sure lots of people that have never experienced pain, they don't understand it. So they may think you're faking it, or they may just be getting annoyed because you said you'd go. So then, yeah, you stop saying you'll go. One thing I did actually move towards was saying, I will be there pending it is not a bad pain day. So I'm still saying I'll go. I still want to be invited. But then when I do say I'm not feeling well, actually, I can't make it 30 minutes before, I don't feel nearly as bad. And that was a game changer when I started doing that.
Mm.
But I feel you on the loss of function. Like, I still feel so guilty because I have to cancel a ton of patient days. I'm lucky to have a good team now, so I can move patients over, but I still feel guilty because the people we treat need treatment too. So, and the grief of what you can't do and all the losses you've experienced, and it's valid. And tell your therapist about that. Maybe there's ways you won't be going and running a marathon, but maybe there's some little goal that we can work towards where you still feel some of that joy. It's not fair. It's not to have, like, some days I'm like, oh, it's good that I have body that is not what I want it to. I get angry at my body, and it is valid, and it is a loss. And when people say, well, you should be happy you can still do blank, blank, and blank, that's actually very detrimental, because then you feel bad for feeling bad.
Right.
So little goals. And even though your massage therapist, your physiotherapist, your chiropractor, your acupuncturist, even though they're not psychologists and it's out of their scope of practice to give you mental health advice, please do explain to them these concerns, though, and how your neuropathy has affected this part of your life.
Right.
You need to know that.
Yeah. You know, we found things like gratitude and meditation and positive thinking, they do have a place. And actually, you can see brain scans that long-term meditators have bigger areas in their brain that deal with emotion and stuff like that. But it's also, you have to find that balance, right? It's okay to not be okay.
Yeah.
And, you know, you shouldn't be getting any grief, no pun intended, because you're not okay today.
That's the thing, I think, because then you feel the shame. Yeah. You feel shame about feeling bad, and I think there's a place for both. Yeah, like celebrating little wins, because in the frustration of having a big loss of not being able to do something you love, but then we get you to a point where maybe you can do this little activity, but it's a huge win. Celebrating those little wins is really important. Being happy about the things you can be happy about, it's so important. But absolutely, I think the idea of it's just, you just have to be grateful all the time, it's not fair. And that a bit of it is what gets you to the place of not being heard by general practitioners. Mm-hmm. So you don't want to say, like, oh, I saw somebody worse when I came in, better not complain, right? Yeah. And then that's not good.
Yeah.
So validation, all care providers should be validating your concerns. If they do not, ask for a new referral. If it's one that you can get, I understand we all have specialists that we have to be with, but if it's your choice, you can find a new one. I'm a big advocate for that with patients. Okay. Find one that suits you. Find one that understands that you're in pain and you want some relief and you want to be heard.
Wonderful.
One more thing, I think, yeah. Mm-hmm. Oh, two more things. Pricing. So for people that don't know, 60 minutes usually ranges between 95 and 150, depending on where you are going, what type of treatment it is. So if it's mobile versus a clinic versus a spa, those are going to range. That doesn't mean it reflects the quality of care. So doing your research, calling, asking how you're doing. Benefits. So some private benefits do cover registered massage therapy. Please check that your massage therapist is registered. So that means that they've met the standard requirements with your insurance company. And AISH, massage therapy can actually be covered by AISH under health-related personal benefits. So if you can get that covered, they will cover it in some cases.
So while we're on this topic, I know the massage colleges will offer a much reduced price for the people who don't have benefits or simply can't afford it. Is that something you would recommend? I know that you're getting students, and you have to keep that in mind, that are being supervised. I actually added that this morning. That's funny.
So the best way for you to find a massage therapist, I recommend always, instead of Google, you can Google neuropathy and massage, but using the association's web search. So our association, the Massage Therapist Association of Alberta, has our massage therapists listed there, so you can find one in your town. College clinics, so the private college clinics and the public ones, they do have students. So you're usually, it's about 25 to 45 for treatment. Call ahead of time, let them know that you're a neuropathy patient. They usually, well, they should be putting you with a term 2 student and up, so second year student, because it is more of a complex case than your average relaxation. But absolutely, it may not be as relaxing, it's not the same, but if you want to have treatment on a specific area, it's also a great tool for the massage therapist to learn about neuropathy. They get that hands-on treatment, so I'm always a big fan of supporting them.
Right. So, and for anybody who's outside of Alberta, your province or your state will have it as well. You just have to know how, you know, go looking for it.
And that's it. Thank you so much.
Thank you so much. That was wonderful. I'm going to unpin you now if I can. There we go. And oh, let's see if I can change that. Okay, so if anybody has any questions, you got a couple minutes here to get them in quick. We're actually over time.
I know, I'm sorry.
That's okay. We had so many questions, which is a really good, it was a really good engaging conversation.
And you can always email us the information there. So
right. So it's samestarswellness.com is your website, right? I had put that in that somebody had asked. And yeah, I just want to remind everybody, we live by donations. So if you're able to contribute, please do. And if you can't, that's fine. CalgaryNeuropathy.com is our website. And whatever you can do. I feel like I forgot about something. That happens every time, I swear. So, okay. No other questions came in. So I really want to, oh, we do have a question about your glasses. People wanted to know about your glasses.
Mine? Okay, so they're Avalux. They are migraine glasses. I wear mine every day because I have suffered from chronic migraine disease, but they are not just rose tinted. They actually block out a lot of different lights. They are considered a medical device and are also glasses. So if you do have private benefits, they can cover them. They're about $375. They do not come in really many other frames. I do realize I look like Elton John, but it helps with the pain. And they take the edge off. And I honestly didn't realize how much the world hurt me until I put them on.
Nice.
They help. I do recommend them. They're great.
Okay. Just so people know, this one was a couple of almost 2 hours. So I'll probably break this video up into a couple of segments before posting it on. And I have no idea when it's going to get up there because it always takes me a really long time. Okay.
Thank you so much, Jessica.
Thank you. Thank you for having me.
It's our pleasure.
Bye, everybody.
Bye, ladies.